Hey, what's up, everybody? Cam Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. So if you're looking to scale a practice, looking to grow a practice, work at a practice, you're an injector, and you're wanting to take your business to the next level, your practice to the next level, give your clients an amazing outcome. Every single one of these episodes that we create, they're 100% designed for you and to help you take your life, your practice, wherever you are in your aesthetic journey, to the next level. So, guys, I have an incredible guest on today, Marissa Palermo. She is from, did I say it wrong?
Marissa Palermo. It's okay.
I got to do another take.
You said Melissa.
I said
Palermo.
Marissa. I said Marissa.
No,
I said Melissa. Oh, my God.
okay.
I'll get your name. It's not that hard of a name. It's been a long day. Hey, what's up, everybody? Cameron Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners, injectors, if you're looking to take your practice to the next level, really your injection career, anything to do with wellness, anything to do with understanding how to run a practice like a business, really delivering patient outcomes, treatments, and continuing to help elevate everything aesthetics. So our intent and our goal with every single one of these episodes is to interview top providers, bring in key opinion leaders, talk about people that are innovating with inside the tech environment, marketing environment, all the crazy things happening in the wellness environment when it comes to GLP-1s, when it comes to peptides. And I have a wonderful guest that I want to bring on the show. She's from Fort Lauderdale, Florida. She's a top 100 injector. She's double board certified, nurse practitioner. She'll tell you everything that she does. She's got an incredible background and story. But I want to bring in Marissa Palermo to the show. Marissa, thank you so much for joining.
Hi, great to be here.
Yeah, so tell us about your background. I know that we were talking offline, and I wanted to call you by your last name was with the Palermo, but it's Palermo.
Palermo. Yeah.
Okay, one day I'm gonna get that, and you can give me a hard time. But tell us about you. I know you're in South Florida. I know that you have a tremendous amount of accolades when it comes to aesthetics, and yeah, I mean that you have a wonderful story, and I think that the audience needs to hear exactly what you've done in order to get put in a position to have such a great career.
Yeah. So I was a little unconventional how it happened with me, but anything that I could do to get into aesthetics, I was going to do it. I've been a nurse for 19 years now, and I started working in the hospital, decided I wanted to get my nurse practitioner. I got my nurse practitioner in family medicine, and I always liked aesthetics. I've been into beauty, for a while. I was getting injections in my 30s. I'm in my 40s now. So it's just always something I was drawn to. But I wanted to do family medicine because I didn't want to be a one-trick pony. I really wanted to practice what I went to school for. So I made myself do that for a couple of years before getting into aesthetics. When I decided that I was done with that at 2 years, I put my feelers out there. I put my resume online, and I put what I was that I was trying to get into aesthetics. And I actually got reached out to by a doctor who was doing anti-aging who wanted to build an aesthetic practice. So I went into doing aesthetics with no experience, which I don't recommend, but somebody's got to start somewhere. So I had gone and done classes when I was doing primary care to get my feet wet and to at least get some hands-on and anatomy and understand before just jumping into it. So I slowly transitioned from the anti-aging into aesthetics, building his aesthetic practice. And that's how it happened. It was very natural, but it was hard because I was a new injector starting a brand new practice. And the biggest thing I can say is I took a lot of classes, got a lot of certifications, watched a lot of videos. And I think that, you need a really good foundation when you're getting into this industry.
Yeah, I mean, I completely agree. I know that you've had a tremendous career, and I know that we're just recently, well, September, you had mentioned, right, that you had just jumped a ship, that you are now working for a pretty large environment, a practice. What you guys have 15 locations, is that right? Okay, gotcha. And did you open up that practice, didn't you?
Yeah, I'm not the owner, but I'm the injector that opened it. I'm the only injector there right now. We will grow and have more in the future, but as of right now, I'm the only one. And we have an esthetician.
Okay, so how many providers are there?
Only me right now
Only you right now.
at
Okay,
this
there's an
location.
SE there at
Correct.
that location. Got it. But 15
Yeah.
locations. Is it private equity backed? Is it? I'm curious to know from the
No,
what's it?
it's a founder, Dr. Gravilla. He's the founder with along with Scott Melman, who's the CEO. They started the first one. They went to college together and they grew it from there. So there's corporate locations and then there's some franchise locations.
Okay.
But the franchise locations are all owned by providers. And they work very closely with them. They know them. It's kind of not just like people coming in trying to open franchises. They're very tight knit with their group and they're very successful because of it.
I feel like there's something in the water. I mean, South Florida, there's so many practices. There's like it's how do you and I know I'm jumping in here, but how do you keep up with the marketing aspect in South Florida? Like there is so much competition, right? How do you continue to stand
There
out? I know
is.
you have a great presence on Instagram. I know we were talking a little bit offline, but what are some of the challenges that you face being in that type of region within the United States?
I think that you really got to do good work and you really need to develop a really good rapport with your patients and have them trust you, and really have the same goals aligned, because there's, like you said, a med spa in every other corner. People can always get it cheaper. But I think what we try to, really build upon is experience, the patient, like I said, the patient goal, just making sure that you're aligned with their goals and what they're looking for and being honest with them. There's times where I'll tell somebody no, and I don't think that's a good idea. And honestly, those patients stay with me because they appreciate that. They appreciate that I'm really trying to give them good advice and looking out for their best interest and maybe saying something that might be something that's not great that they saw online or saw somebody else doing it and why it might not work for them. And I think that is one of the biggest things that sets me apart from what my patients tell me is that they love that I will tell them no and that I'm honest.
Hmm. Hmm. Does that come natural to you? Is that because I know
Yes.
like it does? Okay. Is
Yes.
that just your personality? Is that because most providers struggle with being direct, being an expert, talking to the like getting down to the root problem, talking about the emotional aspect and really building on transformation.
It is 100% my personality. I am a straight shooter with everything that I do. You will never wonder what I'm thinking. I'm very forward, sometimes to a fault. But yes, it's me. I can't like hide it. So when I tell my patients, I'm like, no, I'm like, this is not a good idea. But there's science back behind it. I'm just like, no, it's
Hmm.
not going to look
Hmm.
good because it's my opinion. No, there's science
Sure.
back behind it. There's reason why I'm saying that.
So I love that. I think the fact that you have that personality, you're direct, right? I can tell. Obviously, you're direct. You like to deliver. You're obviously an expert, and there's science, but behind exactly the treatment that you're trying to, the outcome you're trying to give the patient. So, what originally drew you into aesthetics? What was it? I mean, because now it's my sense is, and you can obviously build on this with me, but my sense is you obviously enjoy seeing patients.
I
This is
do.
something that you love
Hmm.
to do. You have the
Love it.
interaction. What
Mhm.
drew you to that? What drew you to aesthetics in general?
I just always liked beauty. I'm vain. I mean, what can I say? I don't know. I love beauty. I like to look good. I like to feel good. And I feel like when you look good, you feel good. So that's something I really believe. And I have just been drawn to that from day one. I've always thought when I look good, I feel good. And I want to help people feel their best in a
I mean, I
different way.
have,
Instead of medicine, it's, aesthetics.
yeah, yeah. I love that. I mean, I have so much respect for providers, and you have such an amazing job. I mean, you have to love going to work and making people feel good and build confidence within themselves and putting them in a position to really have a great life, right? Because you worked in traditional nursing, right? And then you
I
transitioned to
still
aesthetic.
take call at the hospital. I take
Oh, you do?
stroke
Okay.
call. Yeah, I take stroke call and I take cath lab calls. So when people are having heart attacks, I like medicine. I try to keep my foot in the door. So I take call a couple times a month to keep my skills up. So
Okay. So that's got to be interesting to manage. You go from taking a heart attack call to making somebody build confidence and look beautiful. Like those are two different roles.
yeah, I'm helping people in many ways.
You are absolutely. So when did you realize I wanted to get into aesthetics? I mean, I know you mentioned beauty. You love to feel good, look good. I totally get that. Look, I think if you're feeling good, looking good in your, in your clothes, in your car, in your house, whatever it is, your style, your hair, right, the aesthetics aspect, your face. I feel like if you have that, you build confidence, and ultimately you have the position to actually achieve higher performance and make more income,
Yeah,
right? So
I would
yeah,
agree with that.
what was it? Was it to make this your career, right? It's just like your career focus. Was it driven through just like being that provider? I mean, you love being a nurse, you love helping people through multiple aspects, but what was it? What is it that wakes you up every single day and says, you know what, I'm going to go get it? I have patients to see. Is it their joy that drives
It's
that?
absolutely. I had a patient today, which is a crazy story. I had a patient today who came a couple weeks ago to get her first neurotoxin treatment ever, and I took care of her in the hospital. Like she would constantly come to this one department because she had this one issue, and she recognized me, and I couldn't believe it. And she was right; it was me for sure. And I did her first neurotoxin treatment, and she came in because she was feeling really down about herself. She had an autoimmune condition that had really taken the life out of her for the last 10 years. And she felt like she said, quote unquote, I feel like I want my life back. I just want to look better, feel better. I did her first neurotoxin treatment. And you think that this sounds superficial, but I saw her today and she hugged me and said, thank you so much for making me feel so good. I feel like I got a lot of my life back. I actually feel less depressed. You got me out of some of my depression. And she hugged me, and that just felt so good to be able to do that for somebody in a different way. Like you don't always get that when you're a provider in the office or the hospital. People leave, they go about their lives, but like to have somebody come back and have the result and see it and feel better instantly, that's what gets me up every morning. To make people feel good in a different way and just make them more confident, that's what gets me up.
That's what gets you going. I love it. How many patients do you see a day?
Probably right now, because I'm flying without an MA, I would have to say like 12.
Okay, yeah. So you're pretty
Give or
busy. I mean, it
I'm busy.
is
I'm fully booked.
fully
I've
booked.
been fully booked. Yeah.
And is that obviously, coming over to the new practice you said mentioned in September? I know that there's obviously a lot of patient loyalty, right? I'm sure that,
There
like,
is.
there's this relationship, there's this bond, this connection, this trust, right? That takes place, conversations behind the closed door that who knows what happens, right? It's almost like a therapy session in some cases. Um, was that is that easy for you? Was it for because I have a feeling, and you obviously can help me with this, but it sounds to me like your patients they're very loyal, right? They want
Very
to come see you,
loyal.
they want to come back, they refer you. Is most of your referrals for word of mouth?
A lot of them, yes. And I think that just goes for with rapport building. I'm very open with my patients. I talk to them like I'm talking to you right now. I feel like you develop a good relationship. And if you can develop a connection and a good relationship with people, they're going to stay with you and they're going to refer people. And that's why I still right now have my talks appointments at 30 minutes for new patients, because I really want to talk to them and get to know them and get to know their goals. This is not a chop shop. Like I take my time. Even if somebody comes late and I'm a little backed up, my patients don't get upset because they know I take my time and I'm not going to rush them. And they appreciate that. So, it's the relationship that you're initially building with the people and the trust. And, that's what really grows the business, I believe, and you personally as well.
What is a consultation look like for you, right? Let's just say I'm a patient and I come in. What does that experience look like? The door shuts. I'm gonna have a sit down with you. How does that conversation typically go? Because I have been I'm a patient. Okay, I could probably be a better patient. Some would say, but I've seen those consultations go very deep in the sense of like they start asking me great questions, and it starts to peel back a conversation approach in terms of, okay, I'm going to tell you, it's not a fine line and a wrinkle. It's actually deeper than that, right?
Hmm.
Maybe it's an insecurity, maybe it's
Hmm.
intimacy, right? Maybe it's, hey, I want to look better on Zoom. I'm sure there's some, wrinkles and fine lines, whatever that you can fix. But How does that consultation go for you? Because it sounds to me like there's some really nice rapport being built, and a treatment plan that comes out of it.
Yeah. So I always ask the patient original, like when they first come in, I greet myself, I say what they're here for. We sit down, and one of my first questions is like, "Oh, do you live in the area?" Um, I like to open with that because I'm generally curious where they're coming from to see me. Also, if they're from the Fort Lauderdale area or if they're from around where I live, like I could have a connection with them in regards to food or whatever, what their activities are. Then I usually am like, "Oh, what do you do for work?" I'm genuinely curious about what people do for work. I ask everybody. My husband thinks it's so terrible, but I always ask people what they do. And it's so interesting for me, like a lot of things that people do. And we might talk about that a little bit, but it also gives me a little bit of insight what they're doing. Are they out in the sun all day? Are they working out a lot? Are they sitting in front of a computer? So it gives me a little bit of insight in their lifestyle as well. And then we kind of take it from there. And I'm just kind of diving into what their concerns are and if they've had any aesthetic treatments in the past. And, we go through that and I'll treat them. We'll have a full consultation of what I think would benefit them for what they're looking for, maybe a different process. And then as I'm injecting them, I'm giving them education. I'm talking about what I'm doing. I ask them about their skincare routine and things like that. So I definitely take my time with people and talk to them about multiple things, not just maybe what we're doing at that time. And, if somebody might bring up their dog and like, "Oh, I have a dog." And then we're showing pictures of our dogs. And,
Sure.
it's, we get into a lot of different conversations, but I really enjoy getting to know people, and
Mm.
I keep that with me because I had that when I worked in the hospital and when I worked in primary care. I knew a lot about people's lives and I genuinely enjoy that. I like that connection, like a deeper connection. So I look for that with somebody, regardless of what it is.
I love that. And then after the consultation, right, the checkup process. I think you mentioned right now you currently do not have an MA.
Correct.
Okay, yeah. So you're busy. You're charting. You're taking them to the front. Is there an automatic rebooking? Is or talk about that process because I've heard it a
So
hundred
if
different
it's a
ways.
new
Yes.
patient that I've never seen before, I'm automatically rebooking them at the 2 weeks if we're doing talks.
Okay.
Not typically if we're doing filler, but if we're doing talks, I always tell them, listen, it's my first time injecting you. I'd like to see you back. If you're completely happy with your results, you can cancel the appointment, but I want to get you on my books because I'm busy and I want to make sure we have that time. And especially if it's the first time they're ever getting talks, then I would like to see them also. But yeah, I mean, I had a patient that came in today and she was like, "I'm so happy with my results, but I just wanted you to see how good they came out, and
Yeah.
okay, she's taking up a 15-minute slot. I don't care. Look at how happy she is. I get to experience that with her. Then I have 15 minutes to talk to her about something else."
Got it. I love it. Okay. Now you're a top 100 injector. What does it take to make that list?
I don't even know. No, um, no, I think just patient loyalty, people really believing in you, colleagues believing in you, and just really showing that you're supported and other people think that you're doing great things. And it really means so much to me because I still feel like an imposter. I don't know that we're ever like 100% comfortable because things are always changing. Medicine's always evolving. There's always new indications coming out and new products. So to be recognized like that, I was mind blown. It was such an honor. I was so humbled. It was amazing.
Yeah, and just for the audience, you guys, I mean, to be recognized as a top 100 injector in America, it's a big deal, right? It's a big deal. Votes come in from your colleagues, right? I think that you can have some patient voting, but my understanding is the colleagues have to vote amongst each other, and that actually gives you more credibility. And so, look, injectors follow each other, right? Providers follow each other. Colleagues should build off of each other, techniques, trainings. People that have been in the industry long, people that are coming into the industry, we need to kind of pass down those legacies because, look, every injector at some point has an expiration date. Everybody does. It's just what it is, and it's our job to advance the medicine, right? Not me. I'm not a provider, but it's your job. It's my job to help get the message out there. But what separates an elite injector from an average injector?
I think the ability to connect with people. Also, you want to make sure, like I said earlier, you have a really good foundation. So you definitely want to have somebody that's taking anatomy courses, constantly trying to further themselves, learn about new products. I just got a new product that's getting placed in my hand this week for a new filler line that's coming out. And, I never say no, because I think once you start saying no, then you're putting that wall in front of yourself. You always want to advance and go forward. So I think somebody who's constantly learning about the new things coming out, education, and again, having rapport with your patient and being able to say no sometimes, I think those are things that will make you stand out.
Yeah, absolutely. I mean, always advancing, always advancing, never say no, really being open-minded. That the science is actually outpacing the tech, right? Yeah, it's interesting. I see a lot of mistakes being made. I see, there's a whole thing about, most people were overfilled a couple years ago. Now people are using less filler, more Sculptura. I think there's arguments everywhere. You can obviously talk more about that. But what are some of the common mistakes that you see injectors make?
I see injectors injecting when they don't have a good foundation. I see people that are getting into the industry and they are not respecting the industry and the face and what we're doing to people. Um, I think that's probably a big one. And another one I think might be overfilling people. Some people will still overfill. I think less is more, and we don't always need to do that. So I think those are two things that stand out to me that play a role.
Would you say that's just their lack of education and continuing to evolve within the industry and how medicine is advancing?
I think that might be part of it. I think it's also just, I mean, I hate to say it, but sometimes people are just used to putting a certain amount of syringes in people and they think that that's how everybody should look. I think maybe people get filler blind. So I think that's a thing. So I think it's a combination.
You think they get caught in their ways and filler blind. I haven't heard it mentioned that way before, but I could see how somebody could just get stagnant, right? Okay, it's not a one size fits all, right? You have to analyze the face. You're an artist, right? And I think that to your point, some injectors get in the industry for the wrong reasons. Maybe they try to put money first over patient outcomes and over the science behind it. So when you analyze a patient's face, what are you looking for first?
I'm looking for their best feature. So if I see somebody has beautiful eyes, I want to try to do what I can to enhance their eyes. I'm looking for what they have already that stands out to me. I'm not looking to immediately try to change something. I'm trying to look for something that they already have and just try to enhance upon it.
Okay, all right, I like that. And then when you approach, like you talked about natural results, right? And you look, by the way, you look very natural, like very natural. And I would assume some of your patients also have that look. They probably come in, hey, just like whatever you're doing, I want the same thing. Uh, and I value that definitely from the science standpoint. And so, how do you approach natural results versus the, let's call it the overfilled trend? That's
So
the
part of my consultation actually, which I didn't mention, is a lot of times I'll give my patients a mirror and I will say, tell me what you really like about yourself. And whether it's their eyes, their nose, their lips, they'll give me something that they love. And I will agree with them. Like, absolutely. You have gorgeous eyes, and then we move on. Okay, so tell me something that kind of bothers you a little bit, something that you would like to improve upon, something maybe that has changed over the last few years that you're not really liking. And then they'll go into why they're there. Like, what's bothering them? I've noticed this change. I've noticed this is bothering me. And that's when I can say, okay, well, this is happening because of XYZ. We get into anatomy. We talk about the anatomy, the facial changes, what's happening to them, so that they understand from a scientific standpoint what's happening and why we make the suggestions that we make. Because then it makes sense when I'm saying, you're losing your deep fat pad here. We need to fill it and give you a little volume. They understand why I'm suggesting that. So then we move from there, and that's when we make a plan depending on, what they're looking for. But I do pride myself in natural results. I really try to go for more natural results. I definitely think everybody should be taking care of their skin because they can get all the injectables they want. If their skin looks like crap, it's not going to look great. So I really push for skin health. And my patients get great results from it. It might not be overnight, but they're very happy and it keeps them coming back.
Do you recommend a skin regimen for all your consultations?
Yes.
You do. Okay.
Yep.
And I mean, I'm a
Unless
huge
they're late and I'm really
believer.
rushing, then I might not. But typically, and then
Get
maybe
you
on the
next
follow
time.
up. Yeah, exactly. But yes, usually I do. Usually I ask them what they're using. And if they're using some decent products that are working for them that they like, fine, no problem. As long as you're using some sunscreen and you're using something to moisturize your skin, great. But typically I'll ask what they're using and I'll make some recommendations, whether it's something I have or something I don't have. I don't just give them something I have on the shelf. I really try to do right by my patients and making sure I'm giving them the best thing possible.
Pharmaceutical grade skincare, nice regimen, routine. Yeah, yeah. I mean, I've seen before and afters. There's a group that I talked to. They're in California, and they focus on skincare first. It's a husband and wife practice, and their before and afters are somebody that is not on a regimen versus somebody that is and came in and got tox and filler. In the before and afters that I've seen, um, they're night and day. They truly are, right? So
Yeah. I mean, on my own billboard also, my skin is the best it's looked in my entire life. I'm 42 years old. I was on Accutane in my late 20s. I had really bad skin. I never had good skin. So for people first when they see me, almost every one of my patients tells me, "You have great skin." And I'm like, "Yes, it takes time and this is what you have to do. Like 80% of what you do is at home. Let's talk how we can get you there." But I tell them like I didn't have good skin. I didn't until like later in life. And it's because of this, because I did medical grade skincare. I got more on the regimen, especially when I got into aesthetics. I realized how important it was. And, people can change it. They can change their skin.
Yeah, and I mean, you live in South Florida, the Sunshine State. It's always a moving target. So, what is your skin care regimen?
Oh man, I am a Pavis girly. Do
Okay.
you know Pavis?
Yes, I do.
Okay. So I love Pavis because I'm sure I probably have every product ever made with of everything.
I
Makeup,
imagine you have to.
hair, everything. But I'm a simplistic girl. Like I don't want to put five things on in the morning. So I really like to be able to put my one Pavis on, my daytime, the dynamic age defense. I love it. It has sunscreen, has everything. It's like my one and done. I love the wash and they have a great night serum. I do like some products from other companies. I really like Hydrinity. They have a beautiful vitamin C cream that I love. So depending on what's going on with my skin, like in summertime, if I'm having some more pigmentation, I might throw a different product in there with it, maybe some anti-pigment, something like that. But for the most part, I really like Pavis. I really like Hydrinity. Elastin has some great products too, but it depends on the patient.
Yeah, yeah, okay. No, I like that. What would you say if you were to look at the treatments that are currently accelerating right now? Which ones are exploding? Do you see a certain trend that's taking place? When you look at aesthetics in general, what treatments would you say are exploding?
Absolutely. Biostimulators. I'm seeing people want a lot more natural and they're looking at long term now instead of like an instant gratification and quick fix. So Sculptra definitely is taking off. The hyperdilute radius. I feel like people are getting that a lot more now. PDGF. PDGF topically, even with microneedling, definitely a surge in that. I just think overall skin health and natural results in the bioregenerative, especially with peptides and everything else coming out now, people are really asking for those kinds of treatments.
What are your thoughts on peptides, GLP-1s?
I think they're great. I think they're great. They do a lot for people. I've seen them change lives. I think when they're used appropriately, then I mean, it can do so much for somebody. People that have had diabetes, that's under control, weight loss issues their whole life, whether it's from hormones or thyroid or this. I think when they're given by a medical provider and you're monitored by a medical provider, I think they're amazing.
Yeah, I'm a big fan of that. There's so much stuff on TikTok and so much stuff on social media. You can get these peptides from anywhere. Who knows where they're coming from? There's no baseline. People that aren't getting their labs done. I'm such a big fan of putting the power back in the provider, right? I mean, at the end of the day, if we're going to self-inject this thing, we're going to reconstitute it, we figure out our dosage, the vials, the mgs. I mean, come on, it's there's a tremendous amount of education behind it, right? And
But
so
yeah.
I would agree with you on that. And I think that it's being abused, and I think people need to be cautious of it. There's huge evidence that it's, there's a lot of benefit to it, but at the same time, tread with caution.
Yeah. And there's the
Okay.
negatives too when people are just dosing how they want. People are coming in with hair loss, they're having other medical issues. So it is something that really should be monitored, that you should be seeing somebody regularly for, at least having a conversation with a medical provider. Yeah.
Let's talk social media for a second. I know that you have, if I went on your social media, you have like 4 or 5 accounts. I don't know. There's a lot of ats. There's a lot of ats. I'm like, dang, which one is her social media account?
Okay. So
How? Yeah, go
go
ahead.
ahead.
All right. How has social media impacted you in terms of displaying your work? Right, displaying before and afters, connecting with patients. At the end of the day, as a patient, as a client, again, we're buying an outcome. We're buying expertise. We want to make sure that the provider that we choose is going to deliver a result, right? And so, how has social media impacted you as an injector?
So my 5 social media accounts. No, I have a personal account because I thought my family and friends would get sick of all my work stuff. So I made
Mhm.
a professional account only a couple years ago, which I probably should have done it sooner. And then I have a dog account because my dogs are influencers. Um, and that's it. I only have 3. But
Okay.
so I I think that it impacted me because and what how patients look for providers and before and afters. I think how it's benefited me is that I show a little bit of my personality, which if people can connect with you in that manner, that's great. They feel like they know you already before they step in the door. I also reply to all my messages. So if people message me and have questions, I feel like that's a great way to connect with people. They can see before and afters, real before and afters that I don't edit. So people can expect those results in person. So I think that's really important. I think throwing in some education is very important so people know that you know what you're talking about, but also
Mhm.
what is true and what's not true from other things that they might be seeing on social media. So I want to portray that I know what I'm doing and that I'm smart. I want to portray that I'm a person and I have a personality and I have crazy dogs and I ride horses and I have a horse and I'm a person just like they are. But I also want to show them I'm a medical provider. These are the things that I do. These are the things I don't do. Here are my before and afters. This is me and my work. And they can come see me and get a free consultation and take it from there. But I think it really gives you the opportunity to put yourself out there before somebody has to drive into the office and try to figure you out for themselves.
Yeah, they have the ability to find you. I mean, connect with you on a personal level, know exactly what your hobbies are, who you're working with. Showing the personal life, the family life, the hobbies, the expertise. I would agree. So if there was a new injector and they came to you with advice and said, "Hey, I really love aesthetic medicine. I want to get into it. I admire everything you're doing." What advice would you give them if they were new on from a social media standpoint, building a personal brand?
They just need to figure out what means, like what they like, what resonates with them. You don't want to be copying somebody else. You just want to put yourself out there from what you believe in. You want to portray yourself, not worry about what everybody else is doing. You want to make sure you give some education and, as you're starting out, you might have some before and afters, but, you just want to be honest and put yourself out there for the person that you are because like you said previously, they can go anywhere, they can go to the next block and find somebody, but they're going to come to you because there's something that you bring to the table. So I think people really need to sit down and think about what do I bring to the table and then portray that. And that might change, but in the beginning, at least just authentically put yourself out there and what you're doing and it's okay if you say you're new. It's okay if you say that, you're out of school and you're doing this training, you're doing that training. I mean, education is good. People want to see that. People want to know that you didn't just take a 30-minute course online and now you're injecting, so I think showing people your dedication, that also helps.
Being authentic, and really sharing your journey. Everybody's on a different journey, Marissa's on a different journey. You've been at this for a long time. Somebody that's getting into it this year, you got to be honest, you got to be authentic, because in, 5, 6, 7 years, you're going to have the experience and expertise. And yeah, everybody has a story, right? Everybody has their own personal brand. And I think if you hold true to that, of what that is, and not try to copy and mimic and what someone else is doing, then you become yourself, right? And you can really then you kind of let the hair down and get comfortable being on camera, pictures, whatever it is. I would totally agree with you. I think some people really struggle with that. I still hear in today's age, like I can't, I don't do social media, I can't get on camera, I can't have conversations, I can't post. It's just, to me, it's interesting because this is
I
like
mean,
this
I
is the
still struggle
artistic
with
form.
it. I
Yeah.
still struggle with it too. Like I always want to, oh, I don't like that. I want to make this. Honestly, you should just post. You just need to post. Doesn't matter the time. It doesn't matter what you're posting. Just post. And I even need to do better with that. I'm busy. I'm trying to put stuff together. Like I have a sculpture video that I want to do right now because I know sculpture's, you know, getting really hot again. And it's just like you have to find the time to do it and you just got to do it. That's the biggest thing. You just, even if it's not the best thing, even if it's not the best before and after, I've seen some terrible before and afters. And some people love it. They think it's great. It's not overdone. It's not this or that. Like you really never know. I mean, there's something for everybody. You just need to post it and get yourself out there because people are looking and you want to be somebody that's there that they're seeing.
That brings up a good point, because you're busy. You're seeing patients every single day, right? When do you find time to actually post? Does it have to be before or after weekends? You're tired, right? It's hard for a provider.
I do it. Yeah. Sometimes I do it right before work or like when I'm on the couch at home in the evening, I'll try to get some stuff together. If I have some free time over the weekend, if I have a no show for one of my patients, I'll do it during the day in the middle of work. I really try to do as much as I can at work because I really value my personal time. But at the end of the day, it all meshes and you got to do it when you have time. So a lot of times that for me, that's in the morning. I feel most productive in the morning.
Are you on multiple channels, or is it primary Instagram? Where's most of your patients come from?
So I'm on TikTok too, but God knows I haven't posted on that. I totally forgot about TikTok. I just said the other day, I'm like, wow, I haven't posted on TikTok in like 2 months. Whoops. Yes, I would say primarily Instagram. Got to get better with my TikTok. I need to get back on TikTok, but I think they're completely two different platforms. Like you think everybody like crosses. No, like
Mhm.
there's people that are only on TikTok, people only on Instagram. You need to put yourself out there on both of them.
Yeah, yeah, I would agree. I mean, shoot, even where I live is kind of interesting. Facebook is a big deal.
Oh, Facebook. I'm on Facebook and I do get people that say they see me all the time on Facebook. That tends to be a little bit of the older population.
Yeah.
But yeah, Facebook for sure.
The Facebook groups where I live in Northwest Florida, it's a full thing. If somebody asks advice, I've seen it, like, hey, does anybody know the best med spa or injector? And I mean, they freaking moms just go off. And you can kind of see the trend of like who is the top one. And for whatever reason, she's got herself built up, great social media presence, great personality, great educator, great before and afters, and somebody that's taken the time to really invest in their personal brand. So, all right, so let's talk about patient psychology for a second. What do you what do you really what do you think patients really want when they're coming in, right? From your perspective, like why
They
are they
want to
coming in?
look, I feel like they want to look refreshed. Patients want to feel a little better, look a little refreshed. They
And
want
how
some
do
hand
you
holding.
They want hand holding. They want it. They. I mean, I always use the word expertise, educator. Someone they could trust. But it's almost like if you peel back the layers a little bit, they're almost they're vulnerable, right?
Yes,
And they want to
100%.
sit with. They want to share some secret with somebody they trust that can bring some self confidence to their life.
Yeah. And, when people come to me with issues, I'll give you an example. Somebody say, "Oh my gosh, this eyebrow is so much higher than this one. It really bothers me." And I'll be like, everybody has an eyebrow that's higher than the other one. You just make it downplay it because it's true. Like we're not symmetrical. A lot of people have the same complaints. they do, and they don't realize it because nobody talks about it. But I'll be like, yes, that is so common. Or you just make them feel very comfortable and like, no, it's not even a big deal. And just, sure, we can help you with that. Just make them feel like their concern, even though you want to be concerned about it and show them that you care and that you're going to be there to help them, you also don't want to play it up too much and make them think it's a real problem. Because a lot of times to somebody else, it might not be, even though to them it is. You want to, like I said, hold their hand a little bit, let them know it's not as bad as they think, but you're be more than happy to help them and that you're going to try to achieve whatever you can to make them feel a little bit better.
Is it hard to manage unrealistic expectations?
Not for me, because I am very, I am very like, I had somebody today that's like, I want to do another syringe of filler in my lips. And I say, we are not going to fit another syringe of filler in your lips. You're going to get a half.
Maxed out. You are maxed out.
I'm like, that's it. Or, there are patients that I do feel like that have unrealistic expectations, or they're coming in and they've had filler from multiple different injectors and it sounds like they're never happy. And I'll just be like, I think what you're trying to achieve, like, I just don't know I can get you there. Or I don't ever say I'm not the right injector for them, but I will just say that I don't think that that's the right treatment for them. And then either they go somewhere else or they appreciate what I said. But at the end of the day, like you said, I'm an artist. That is my billboard right there, walking around. That's my advertisement, and if they really want it done, they can go somewhere else. And I hate to say that, but I'm not going to compromise my integrity and, what I think can cause a problem for somebody just because somebody has dysmorphia or another issue going on. Um, and sometimes they appreciate it. And sometimes, I mean, I have to say most of my patients appreciate it. I don't think I've ever really had somebody push back with me when I tell them. Most of the time they're telling me that they really appreciate it and thank you so much. And they've never been told no. And I tell them, I'm so sorry. That's unfortunate. Like I had a girl come in the other day that she wanted facial balancing. And I'm like, for what? I'm like, you're gorgeous. I was like, don't touch your face. And she's like, seriously? She's like, you don't think I need? And I said, no, you don't need anything. You're gorgeous. And she was like, oh my God, and hugged me and was like the happiest person leaving the office. Like, could I have done something in her face? Probably. But like, she really didn't need it. Like, I don't want to mess up her face. She's gorgeous. Do you want to work on your skin? We can work on your skin. Let's do some microneedling. But facial balancing, no. Like people
Your
see
balance
online
girl.
facial balancing, and this is like the new thing, and people don't even know what they're asking for.
Oh, geez, social media can just really mess with people sometimes. I mean, I love that, And it was probably one of the best consults you had. I mean, not the most profitable consult, but at the same time, she's going to send you so many referrals. She has so much respect for that. She's going to be
Yep.
coming around. I mean, that's what it's all about. Like for the audience, look, sometimes saying no, guys, is the best thing. It truly is because you have to own your integrity, just like what Marissa said. That is your billboard. That is your advertisement. Sometimes saying no truly is the best outcome. And when you deliver that outcome, even if it's no, it's going to come back 10x.
And I
Truly
have to tell
believe
you, if you go and look at my reviews, a lot of reviews say that. She'll tell you, no, I respect her. She's a very natural injector. And I get so many patients because of that tell me, because I'll say, oh, how did you hear about us? And oh my God, I read your reviews. You're very honest. You're, very natural. You take it step by step. You don't push people and that is a huge part of my business. People that read these reviews and see what other people are saying, and that I say no, and that I'm very honest, and I take a slow approach because I do. And I'm busy. It's not like I'm, needing so much work and I just want to say yes to everybody, but I'll say no to people too because it's my integrity at the end of the day. And like you said, they'll come tenfold. It'll come tenfold to be able to say no to somebody. We can offer them something else. It's not like I'm telling them, no, never come back here. It's just that treatment might not be the right one for you.
and that's what new injectors need to hear, right? So anybody that's new trying to get in the industry, it's things like that, right? Because they're going to say the wrong thing. They're going to say yes to everybody. They're just not confident. They're not educated. Maybe they need the income, right? Maybe they haven't taken all the classes. Those types of things. But for you, right? What will be for a new nurse coming in, becoming a new injector? Where should they start? What advice would you give them?
I would start with taking some classes, like hands-on Botox classes, hands-on filler classes, with top reputable providers, injectors that offer these types of trainings. That's what I did. My mentor, who actually gave me this lip necklace, Lamore Beauty Bay, she's been my mentor from the get-go. I started shadowing her when I was in nurse practitioner school, and I think taking her classes and just having her as a mentor has helped me tremendously in so many ways. And when you connect with somebody and you have somebody as a mentor like that, and you have them in almost any area that people are injecting, there's always a trainer that does classes on the side that you can actually inject on models and have them there with you. But most of the time when you leave that training, that person will give you their number and say, listen, if you ever have a problem or a question or a concern, here is my number. And I think that is such a good resource to have. So I think new injectors need to get hands on, do some classes, make some friends, join the group, the camaraderie, so that you have backup in case you have a problem or you have a complication or you have a question, that you can talk to somebody about and somebody can help you through it. Go to the conferences, make friends in the industry, know your stuff, learn more, develop your group. I mean, it's that really will help you become a better person and a provider. And God forbid you have a problem, you have somebody else that can help you that might have a little bit more experience. So I think every nurse starting out should do that.
Yeah, I agree. Conferences are huge. I mean, all the continuous education on the business side, on the anatomy side, it's critical. It's absolutely critical. And to have a mentor, I mean, everybody needs a mentor. Everybody needs somebody they can fall back on, call. It's not a weekend course and all of a sudden you're certified and you're this master injector. It's continuous education, and like I said earlier, the science truly is outpacing the tech, and it's man, aesthetics is moving so fast. It's really interesting to watch. I think it's a very sought after industry. I think vanity and social media is helping amplify that, but at the same time, injectors like yourself have done it the right way, and all your patients definitely thank you for that,
Yeah,
for
we have to
sure.
remember this is medicine at the end of the day, and we can't let
Yeah.
social media take the medicine out of medical aesthetics. We are prescribing something, we are giving something to somebody. If somebody is asking me that they don't want to pay that much for Botox and they want a lesser, treatment, I'm like, well, you don't go to your doctor and get 3 days of antibiotics when it's supposed to be 7 and think your infection is going to be clear. Like you're not going to go to the dentist and get a dental cleaning and not brush your teeth when you go home. Like, there's things that I'm recommending because I am a medical provider and I'm providing medicine. I mean, at the end of the day, we are injecting people with something. Like we have to remember that we need to stand up for ourselves also. And that we are medical providers and we are providing a service to people instead of people coming in and requesting and telling us what they want us to do. Because that's not always the best thing. Sometimes they might know what they're talking about, but you got to remember that this is your license.
It's almost like the vanity is definitely getting in the way of the medicine because of the social influence, huh?
Yeah, sometimes it is, but I think if we stick together as providers and people in the industry, I think we can change it, or at least stop it from getting worse. But I think everybody really needs to be on the same page, and I think it's kind of moving in that direction now because I've really been seeing a lot of that recently.
I've seen, yeah, tremendous amount of compliance and safety. There's a lot, taking place in Capitol Hill right now, even on the peptides and GLP-1s.
Yeah.
But yeah, to your point, I mean, it's there is a stance. This is medicine at the end of the day. You're injecting definitely a drug, and we have to deliver safety and patient outcomes. So I absolutely admire that. What would you say? I know you have to go. I know you're super busy. We'll wrap up here in a second. But what what is the hardest area to inject? Would you say
Under eyes.
under the eyes?
I don't do it.
You don't do it.
I don't do it because I just think it's a really delicate area and I'm seeing a lot of poor outcomes years later. So I think under eyes is probably the hardest place to inject to get a really good outcome for, the duration of the treatment, really.
Is it? Do you use the cannula as well?
I use cannula needle. Mhm. both.
Yeah, both of them. How do you use one over the other, or does it just kind of depend on the patient?
Depends on the patient.
Gotcha. Okay. Last one for you is, where do you see the industry going? And I was going to say 10 years. I think that's a long time horizon. 5 years since it's moving so fast. Where do you see this going in the next 5 years?
I think it's going to continue to grow. I mean, we're going to have more things available to us. We're going to have less downtime with better outcomes. We're going to have better results, better outcomes in shorter periods. Like people are going to have less time to recover. I just think the technology is growing and the industry is just going to grow with it. With that being said, I think biostimulatories are just starting to take off, even though we've known they've been around for a while. I think people are really now just starting to become up to it. So I think biostimulators over the next few years are going to get a lot more respect and people are going to value them a little bit more. I think fillers will come back around because there's always going to be a place for that. So I think the whole overfilled thing I think that's starting to die down a little bit. But definitely with technology and biostimulators, I see growth.
Yeah, I mean, I've been at it for 10 years and I've just seen, this huge growth. It just continues to compound, to 15, 20% per year. And I agree. I'm bullish on obviously the growth, accelerated continuous growth, and growth in the right way. I think in the past 2 years, we've done an interesting job of flushing out what should have been flushed out, right? I think there was people that were injecting and people getting in the industry for the wrong reasons. A lot of those doors have actually closed, right? Those practices, those injectors have moved on, and it's. I don't think it's the survival of the fittest. I think it's survival of the individuals that are doing the right thing and delivering the outcome and saying no when you're supposed to be saying no, and really having incredible marketing and a loyal patient base.
Yeah, definitely. I agree.
Okay, well, I appreciate you. Thank you so much for taking the time to tune into the show. Super valuable, super inspirational, tremendous amount of insight. If people want to connect with you, Marissa, where is a good place for them to go?
Yeah, and feel free to message me. I'm a girl's girl through and through, men and women actually. But if anybody has any questions, they want to talk further about getting into the industry, I'm more than happy to help people and help guide them. On Instagram and TikTok, I'm Marissa, Marissa, the Injector.
All right. Thank you so much. Hey, guys, if you've enjoyed this conversation, connect with Marissa. Go follow her on Instagram. She's one of the top 100 injectors, inspirational, gives tremendous results. And if you like this particular episode, my only ask is you share it, subscribe, and continue to tune in. We're going to continue to give value here. And my only ask is you guys share it, rate it. So I'll leave it at that. Until next time, happy injecting.